Mr. Speaker, a constituent recently shared an enlightening yet frightening experience. It started with a trip into the ER on a Saturday with severe head pain. The physician who saw her diagnosed her with a migraine and sent her on her way. She then returned on Monday, still in extreme pain, vomiting, and unable to eat. Again, she was turned away, her pain dismissed as a simple migraine. It wasn't until Thursday, 5 days later, that she received a CT scan and it was found that she was actually suffering from a brain bleed and was in need of urgent care. She feels certain that this would not have happened to her had she been a man complaining of pain and believes that this was a prime example of implicit gender bias. A question to the Minister of Health and Wellness. Can you provide the House with your opinion of gender bias in healthcare and its severity in the PEI health system?
The Honourable Minister of Health and Wellness.
Thank you very much, Mr. Speaker. Mr. Speaker, I have the highest amount of respect for healthcare professionals here in Prince Edward Island. I know a lot of the individuals that work in the emergency departments all across Prince Edward Island, but in particular at the QEH. Mr. Speaker, I look at the makeup of that cohort, Mr. Speaker, and it's made up of both male and female clinicians. Mr. Speaker, to me, my opinion of the people that work in our healthcare system, Mr. Speaker, as far as gender bias goes, when a medical professional here in PEI is making a clinical diagnosis, I would not think that there would be any gender bias involved at all, Mr. Speaker. Thank you.
The Honourable Member from Tyne Valley Sherbrooke, the final question.
Thank you, Mr. Speaker. I just want to highlight for the Minister that there is such a thing as implicit bias, which is not malicious or even necessarily conscious, but is just a part of what is happening in our society, and it does impact what's happening in our healthcare system. In fact, there is a considerable amount of research to show that in healthcare, gender bias is an issue that negatively impacts women. Gender bias has been studied by many experts. One of my personal favorite reports on this topic is appropriately called Brave Men and Emotional Women, which I think speaks for itself. An example would be endometriosis. This is a condition that is chronically underdiagnosed or misdiagnosed in women. A question to the Minister of Health and Wellness. Have you consulted with the Minister responsible for the status of women on the ways that your government can ensure that all islanders receive the same level of care regardless of their gender? And in particular, can you elaborate on what steps you are taking to ensure women get better treatment and diagnosis for endometriosis?
The Honourable Minister of Health and Wellness.
Well, thank you very much, Mr. Speaker. Mr. Speaker, the Minister responsible for the status of women certainly have lots of conversations back and forth with regards to many topics, and I'll admit here right now, today, that no, we haven't actually had a discussion on that, but we will. But furthermore, Mr. Speaker, I'd like to extend an invitation to the Honourable Member. I meet regularly with the different cohorts, whether it be orthopaedic surgeons, the Medical Society PEI, the ER doctors, either at PCH, QEH. I was down in Montague last week and met with all the RNs in the ER department. But if the Honourable Member would like to attend the next meeting with the ER doctors at the QEH, I would be more than happy to have you attend with me, and you can put that question to them in that room then, and we'll see what their response is. Thank you very much, Mr. Speaker.